Right now, there are millions of Americans over 60 taking blood pressure medications every single morning, trusting that those pills are protecting them. And most of the time they are. But there are 3 specific blood pressure medications. Medications prescribed millions of times every year that have a hidden problem your doctor probably hasn't discussed with you. They are slowly, quietly damaging your kidneys. And what makes this so dangerous is that you feel absolutely nothing until it's serious. Here's what makes the situation so alarming. Kidney damage from blood pressure medications doesn't hurt. There's no burning, no aching, no warning signal your body sends you. By the time most people find out there's a problem, they've already lost a significant portion of their kidney function permanently. And once kidney function is gone, it does not come back. I'm Dr. kenD, and this is exactly the gap I designed my guide to fill. The blood pressure protocol includes word-forward doctor scripts you can bring to your next appointment so you know precisely what to ask about your kidney function and what your numbers actually mean. You'll find the link in the description below. If you want clear research-backed health information built specifically for people over 60, subscribe so you don't miss what we're covering next. Now let's get into exactly which 3 medications we're talking about, and more importantly, what you should do about this starting today. The 3 blood pressure medications with the strongest documented evidence for kidney damage in adults over 60 are diuretics, specifically hydrochloroid and thiamide. AC inhibitors like Linapril and NSA is taken alongside these prescriptions. Now I know that last one raises a question. Are NSA's blood pressure medications? No, they're not. But here's why they belong on this list. Over 40% of people taking blood pressure pills also regularly take ibuprofen or naproxen for arthritis, back pain, or headaches. The combination creates a kidney-damaging chain reaction so well documented that nephrologists, kidney specialists, actually have a name for it. They call it the triple whammy. When these 3 types of drugs overlap in your body simultaneously, the risk of acute kidney injury increases dramatically. A study published in the British Medical Journal found that the combination of an ACE inhibitor, a diuretic, and an NSAID doubled the risk of acute kidney injury in adults. Let that sink in for a moment. Double. And if you're over 60, your kidneys are already working harder than a younger person's kidneys because kidney function naturally declines roughly 1% per year after age 40. That means the risks hit seniors harder than anyone else in the population. Let's start with diuretics, because this is the one that surprises people the most. Diuretics pills like hydrochloroid, thiamide, and chloroladone are prescribed to lower blood pressure by making your kidneys flush out extra sodium and water. They work. They genuinely work for blood pressure control. But here is what almost nobody explains at the pharmacy window. When your kidneys are constantly being asked to push out more fluid, they need adequate water to do that job safely. Most seniors are mildly dehydrated to begin with. Studies show that up to 40% of adults over 65 are chronically underhydrated. Combine that baseline with a diuretic, and you're creating a situation where your kidneys are working at full capacity without enough fluid to perform the job properly. What happens to an engine running without enough coolant? It overheats. Your kidneys do something similar. The tubules, the tiny filtering channels inside your kidneys, need either become concentrated and stressed. Over time, this contributes to a condition called chronic kidney disease, where your kidneys gradually and silently lose their ability to filter waste from your blood. Right now, think about your blood pressure medication. If the name ends in IDI, hydrochloroid, chloroladone, or if it's thiamide, you're on a diuretic. Comment below and tell me, did your doctor ever talk to you about how much water you need to drink while taking this medication? I genuinely want to know because in my experience, this conversation almost never happens in a 7-minute appointment. Now let's talk about ACE inhibitors. These are some of the most prescribed medications in the entire world. Linapril, enalapril, ramipril, names that millions of seniors know by heart. ACE inhibitors work by relaxing blood vessels, and for the majority of people, they are safe and effective. But there is a specific situation where they become dangerous for your kidneys and your doctor may not have checked you for it. It's called renal artery stenosis, a narrowing of the arteries that supply blood directly to your kidneys. This condition is more common in older adults. It often causes 0 symptoms. And ACE inhibitors make it significantly worse. Here's the mechanism. Your kidneys depend on a certain level of internal blood pressure within their own tiny vessels to filter blood properly. ACE inhibitors reduce that internal pressure throughout the body. In healthy kidneys with open arteries, that reduction is manageable. But in kidneys fed by narrowed arteries, reducing that pressure is like trying to push water through a partially kinked hose. Almost nothing gets through. A 2021 review published in the Journal of the American Geriatric Society found that seniors with undiagnosed renal artery stenosis placed on ACE inhibitors experienced measurable, significant drops in kidney function within the first 6 months of treatment. Let me tell you about Margaret. She was 68 years old when she came in with elevated blood pressure and mild ankle swelling. Her doctor, a good doctor, put her on Linen. It was a reasonable evidence-based decision. Her blood pressure improved. She felt perfectly fine. But at her 1-year checkup, her creatinine level, a marker of kidney stress in your bloodstream, had risen noticeably. Her doctor investigated and found she had moderate renal artery stenosis that had never been detected. The Linapil hadn't caused the narrowing, but it had been quietly stressing her narrowed kidney vessels for 12 unmonitored months. Her medication was adjusted. Her diet was modified and her kidney function stabilized. But those 12 months of silent damage could not be reversed. Margaret did everything right. She took her medication as prescribed. She went to her appointments. She felt completely fine and her kidneys were still being affected without a single warning sign. So how do you know if you have renal artery stenosis? The most reliable screening tool is a kidney ultrasound with Doppler imaging, a non-invasive test that checks blood flow to your kidneys directly. If you've been on an ACE inhibitor for more than 6 months and nobody has monitored your kidney function through a creatinine and GFR test, that is something you need to bring up before your next appointment ends. But here's what I want to make sure you understand, because this third factor affects almost everyone on blood pressure medication, and most people have absolutely no idea it's happening. Stay with me, because what comes next changes how you think about something you may be taking every single week. NSAIDs, ibuprofen, naproxen, aspirin at high doses do something very specific inside your kidneys. They block substances called prostaglandins. Prostaglandins help regulate blood flow through kidney tissue. When you block them, the blood vessels inside your kidneys constrict. Less blood flows through, less waste gets filtered. Under normal circumstances for a young, healthy person, this is a short-term minor effect. But if you're already on a diuretic that's reducing your kidney's fluid volume, and you're already on an ACE inhibitor that's reducing kidney blood pressure, and now you add an NSAID that's constricting kidney blood flow, you have created a perfect storm. Each drug alone carries manageable risk. Together, the combination can cause what's called acute on chronic kidney injury. Research published in POS Medicine found that the combination of an ACE inhibitor, or ARB, a diuretic, and an NSAID tripled the risk of hospital admission for acute kidney injury compared to people taking none of these medications. 3 times the risk common everyday medications sold freely over the counter. And nobody is intentionally taking 3 kidney-damaging medications. People are taking a prescribed blood pressure pill, another prescribed blood pressure pill, and a painkiller they've been using for years for their knee. Their cardiologist prescribed one medication. Their internist prescribed another. They picked up ibuprofen at the grocery store because it always worked for pain. 3 separate decisions, 3 different providers, one silent problem building in their kidneys over months and years. The question I hear most often is this: how would I even know if this were happening to me? The honest answer is you probably wouldn't. Not from symptoms alone. Kidney disease in its early stages is almost completely silent. By the time you notice persistent swollen ankles, unusual fatigue, or changes in urination patterns, you've typically already lost 30 to 40% of kidney function. The only way to catch this early enough to matter is through blood tests. Specifically, you need a creatinine test and a calculated GFR, glomerular filtration rate, which tells you what percentage of your kidney function is still intact and working. A GFR above 90 is normal. Between 60 and 89 suggests mild decline. Below 60 indicates moderate chronic kidney disease. Below 30 is serious territory requiring urgent medical attention. If you are over 60 and taking any blood pressure medication, you should be getting your GFR checked at minimum once a year. Not because something is necessarily wrong, because catching early changes gives you time to adjust course before permanent damage accumulates. If your doctor has not ordered a comprehensive metabolic panel which includes creatinine in the past 12 months, ask for one at your very next visit. Comment below right now and tell me, when was the last time your doctor checked your kidney function? Was it within the last year, 2 years ago, longer than that? I want to understand what's actually happening out there in real medical practices. Now, here is the relief in all of this. None of what we've covered means you should stop your blood pressure medication. Managing blood pressure is genuinely critical for long-term health. Uncontrolled high blood pressure actually causes far more kidney damage over time than the medications we've discussed today. The goal is not to stop treating your blood pressure. The goal is to treat it smarter, more carefully, and with your eyes open. Here is exactly what to do step by step. First, at your next appointment, ask specifically for a kidney function panel, a creatinine level, and an eGFR. If you're on a diuretic or ACE inhibitor and haven't had this checked in the last 12 months, write this down. I'd like to check my creatinine and GFR to make sure my blood pressure medication isn't affecting my kidneys. Those exact words. Your doctor will know exactly what to order. Second, if you take ibuprofen or naproxen regularly alongside blood pressure medication, talk to your doctor about alternatives before your next dose. Acetaminophen, Tylenol, does not have the same kidney constricting effect as NSAIDs and is often a safer daily choice for seniors managing blood pressure. Topical NSAIDs like diclofenac gel applied directly to a painful joint are absorbed locally with far less systemic effect on your kidneys. Ask your doctor which option fits your situation. Third, if you're on a diuretic, daily hydration is not optional. It is protective. You should be drinking a minimum of 6 to 8 glasses of water per day. Many seniors intentionally limit fluids to reduce bathroom trips, and I understand that concern completely. But chronic dehydration combined with a diuretic is one of the most preventable forms of kidney stress that exists. Talk to your doctor about finding the hydration level that works for both your blood pressure management and your daily life. Fourth, if you've been on an ACE inhibitor for more than a year and have never had any imaging of your kidney arteries, ask whether a renal Doppler ultrasound is appropriate for your situation. This is especially worth discussing if your blood pressure has remained inconsistent despite medication or if your kidney numbers have shifted on any blood test. Fifth, and this may be the single most impactful habit change you can make, bring a complete medication list to every single doctor's appointment, every prescription, every over-the-counter medication, every supplement. The dangerous combinations we've discussed almost always develop because no single provider has the complete picture at one time. One comprehensive list every appointment. This one habit alone can prevent serious, irreversible harm. Before acting on anything in this video, one critical safety note. Do not stop any blood pressure medication without speaking to your doctor first. Stopping a blood pressure medication suddenly can trigger dangerous blood pressure spikes and serious cardiovascular events. Everything here is designed for a conversation with your doctor, not an abrupt, independent change. Your doctor is your partner in navigating this safely. Let me close with Frank. He was 74 years old, had been taking hydrochlorioid and lisinopril for 6 years, and also used ibuprofen 3 or 4 times a week for hip arthritis pain. He had no idea there was any concern. He felt fine. At a routine blood panel, his GFR had dropped to 54, lower than expected for his age and clearly trending in the wrong direction. His doctor switched his pain management to acetaminophen, optimized his daily hydration, and carefully adjusted his diuretic dose. Over the following 18 months, his GFR stabilized at 58. It did not fully recover. Kidney function rarely does once lost, but it stopped declining. Frank went from a trajectory heading toward dialysis to maintaining stable, preserved kidney function for years. Early detection made every difference in his outcome. Here's the bottom line. 3 common medications, diuretics, ACE inhibitors, and NSAIDs taken alongside them, carry well-documented, research-supported risks for kidney damage in adults over 60. The damage is silent. It builds slowly, and it is far more common than most patients realize. But you have real options. You can monitor your kidney function. You can adjust medication safely with your doctor's guidance. You can protect your kidneys without sacrificing blood pressure control. Knowledge is the most powerful thing you have walking into that appointment. Comment one of these 3 responses right now. Comment checking soon if you're going to ask your doctor about kidney function at your next visit. Comment already monitoring if you're already getting regular GFR tests done, or comment sharing this if you know someone who needs to hear this information today. I read every single comment and I genuinely want to know where you stand. If this kind of honest, evidence-based health content matters to you, subscribe to this channel. We cover exactly these kinds of hidden health risks every single week, designed specifically for adults over 60. Next week, I'm going to walk you through 5 specific warning signs on a routine blood test that can predict kidney disease 3 to 5 years before symptoms ever appear. And most doctors never point them out explicitly to their patients. You'll absolutely want to watch that one. I'm Dr. kenD Barry. Take care of your kidneys. They've been quietly taking care of you your whole life.